Hi, I'm Philip Charlesworth. I'm a consultant urological surgeon and I'm based in Berkshire in London. We begin our insertion 1 or 2 fingers above the ultrasound probe, angling downwards with the insertion needle with the Barrigel already primed. As we come over the rectal hump, it's really important that we visualize the whole of that needle, particularly the tip. Now, with small rotational movements and small movements of your hand, you can keep the tip of the needle in sight the entire time. As you slowly move that needle tip through past the apex and the mid and towards the base of the prostate, keeping the tip of the insertion needle in sight at all times, I've now switched to an axial view whereby small wiggling movements of the needle we can confirm that we're exactly in that fat space. The rectum is not tenting up below us and there's no movement of the rectum as we move the needle. Now, as we have moved that needle through the undisturbed fat space, we can now safely start our placement of the gel. As you're inserting, you can see the lifting of the Barrigel as it lifts the prostate up and pushes the rectum away and dissects and gel dissects out that space. As we come back to the sagittal view, we can see how that gel has distributed itself nicely in the base to mid of the prostate, and we can start building that gel placement up towards the apex. We're coming towards the end of this syringe, so we'll switch out this Barrigel syringe and simply use the next 3cc syringe that's available. It's important as we change that you hold the tip of the Barrigel syringe, and as you screw that on to the luer lock of the insertion needle. In this patient, as we slowly bring that needle back towards the apex, and we can see that gel dissecting the space out, pushing the prostate and the rectum away. In this patient, we lose a little bit of contact from the rectum on the ultrasound probe, and this can happen either through a small amount of gas that can get in that area, or the patient, if they're done under local anaesthetic, lifting themselves off the probe. By relaxing the patient and bringing the patient back down on the probe, and also by small movements in and out of the probe and left and right, that gas will get redistributed and contact will get re-established with the probe, and we get a nice view of our anatomy back. Now that we can see the prostate and the space and the tip of our needle again, we can safely continue our insertion. One of the other great benefits of working with Barrigel is that you're not limited by the volume that you require per patient. For the larger prostates, you can use as many Barrigels as you feel is required to really create the optimum space. Furthermore, for each Barrigel that you use, there's no mixing. The syringes are pre-filled and are ready to go for each time you want to increase the volume of your space. Now that I've completed the midline deployment of the gel, we can then start concentrating on where we feel that there will be some benefit to the patient and to the patient's anatomy of deploying additional Barrigels to gain extra space and to really sculpt it for the individual patient and create a bespoke spacing. I'm concentrating now towards the right side of the patient. On the midline, I was deploying the gel in the sagittal and then confirming its placement in the axial. Once you know that you've got good space, and you know where the rectum is and you're away from the rectum, you can also deploy the gel on axial and check on sagittal. In this case, I can see that as we go towards the base on the right hand side, this patient would benefit from some further gel. And I can just work slowly, analysing the space and just adding small amounts of gel where I feel appropriate. What's really nice about working with Barrigel is that you can take your time. There's no rush, the patient's comfortable, and can insert small areas of Barrigel where you feel the space is required, and you can build up a bespoke sculpted area underneath the prostate to really optimize the patient's radiotherapy. I'm now happy with the separation on the right hand side. I'm now concentrating on the left hand side. I've switched to a sagittal view here, and as you can see, just at the apex of the prostate, this patient would benefit from having a little bit of additional Barrigel towards that left apex. By positioning the tip of the needle exactly in the area that you feel the additional Barrigel is required, again we can slowly insert and top up small amounts of gel to build the perfect space. Now that the insertion is completed and the needle is removed, we can check the symmetry and the distribution of the gel, and we can see in this patient that there's very nice separation from apex to base, and as we rotate in sagittal from left and right, we can see that that placement of the gel goes right the way across and underneath the prostate,